there is an exposure, it assists us in contact tracing and notifying everyone who needs to be notified that they need to watch for symptoms.
That was Nicholas Rupp with the Salt Lake County Health Department on the importance of contact tracing in case of exposure at a public gathering or event. But notifying everyone who could have been exposed in just one instance of the virus really can be a massive undertaking. So how do Utah's health departments and healthcare workers accomplish the immense task of contact? Well, here to walk us through it is TAIR KIPHIBANE, Infectious Disease Bureau Manager for the Salt Lake County Health Department. Thank you so much for joining us here today.
Thank you for having me tonight.
An important topic and something all of us need to be attentive to, because it could be any of us that are, of course, impacted by it or in close contact with somebody who tests positive. So give us an overview of contact tracing.
So with contact tracing, when a person chooses to get tested for COVID, and when they test positive, their positive test result get reported to the Utah Department of Health, and then the cases get dispersed to local health departments. And when it gets to our local health department, we assign the cases out to contact tracers to reach out to the individuals very quickly. So they start making the phone calls, and once they are able to get a hold of them, they start to provide education about quarantine and isolation and general information about COVID. And if they need a letter for work, they provide a letter as well. And if they need information on testing sites, and our contact tracers are there to assist the infected individuals with all the information that they needed. And if they need resources to connect with food or other assistance, they also make referrals and connect them to the resources as well.
So what are you trying to accomplish with that, TAIR?
Our sole goal, our sole purpose of doing contact tracing is to mitigate the spread of COVID-19. At present time, we don't have the vaccine to prevent the spread. So one of the best things that we can do is to reach out to the people and stop them from going out and continue to spread the illness.
So one difficulty is some people may not be willing to help out with contact tracing. Why would people not be willing to help out with it?
I think there are many reasons, and one of the reasons that I can think of is people are tired. It's been a long time that we've been doing this. We have been dealing with COVID for now 8 months, and people are just tired. And who wants to sit at home when they feel well? Maybe after day 2 or day 3 after the infections, they want to go back to work. They have to provide for their families. And sometimes they don't want to have that stigma. They don't want to be stigmatized, and so they don't want to talk to us, and they don't want us to tell them that you need to reach out to your contacts and let them know to get tested or to watch for signs and symptoms.
It is such a complicated matter. It really is. So what impact does it have on the health department when people don't help with contact tracing?
It makes it very, very difficult for us. Our work, it's huge. I mean, there's a lot of cases that keep coming in. And our goal is to stop the spread. And if people do not talk to us, we're not going to be able to provide them with the information that they need to isolate and to let their contacts know to be in quarantine. And the virus can continue to snowball.
So what are the numbers, or are the numbers, I should say, underreported if people do not contact trace?
Definitely. I think that by people are not talking to us, we're not able to reach them. We're not able to tell them to reach out to their contacts and maybe recommend testing to those contacts. When people are not tested, obviously, even if they're sick, they're going to be underreported. People may be infected with COVID-19, but if they don't test, they're not going to know.
We have such alarming numbers anyway. To think that that's underreported, that's a tough pill to swallow. Tell us too then, TAIR, just your final thoughts. What do you want to say to the people about this issue, and again, the importance of it all?
The key message we want to get out is don't be afraid to talk to us. As contact tracers, reach out to that if you test positive for COVID, we prepare to speak to the health department contact tracer. We're here to help. We're here to guide you through this process. It could be kind of lonely. It could be when it happens, it could get very personal and it could be scary, but we're here to help. So don't be afraid to talk to us, and continue to follow the recommendations of masking, social distancing, get tested if you're symptomatic, and wash your hands well, keep your living quarters clean.
Right, we can't repeat that enough. And real quickly too, You talked about how there's maybe a negative stereotype. You don't want to be the one to have to admit, hey, I have come into contact, or I myself have tested positive, so now I have to tell you about it. How can we as a community and as the state break down that negative stereotype or the negative emotion that comes with it?
I think that we just need to realize that, you know, it is part of living in a community. It's a disease that we can't avoid. It's here in our communities. And I just think that we need to have sympathy if people get sick with COVID, instead of saying, ew, you know, I don't want to be close to you, or stigmatize them, label them with, you know, you're sick with COVID. Be understanding. It's okay to take a meal over to a neighbor or a friend when they're sick. It's okay to call them and say, hey, how are you doing? And it's okay if they call you and inform you that, hey, I am sick with COVID, and I just happened to spend, you know, a couple days before I got sick with you. And just be understanding, be responsible, get tested. It could happen to you. It could happen to any of us.
It really can. Thank you. That is such wise advice, and I hope something that people will listen to and adhere to and help out, so we can do that contact tracing to hopefully slow the spread, so that sometime sooner than later we can get back to normal. All right. Thank you so much again for your time.